Good afternoon, everyone, and welcome to the Bloomington Rotary Club's weekly celebration of service. And my, what a full house we have. It looks fantastic to see all these faces. So glad to have you here. My name is Tracy Ivanovich, and I'm honored to serve as your president for 3 more weeks. Um, in honor of Memorial Day, D-Day, which is coming right up on the 6th, I'd ask everybody who is able to please stand and let's do the Pledge of Allegiance. I pledge allegiance to the flag and the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you. So a little bit lengthy thought for the day, but I thought it was important to highlight that last week, Bloomington lost a very, mourned the loss of Suzanne McDonald, a remarkable woman who left an indelible mark on the world and embodied the best of IU and Bloomington. She's passed away early on Thursday, and she left behind an international harp legacy that united people of all ages, races, religions, and cultures from around the world here in our town. Her passion for the harp and her dedication to ensuring others had access and support were evident in the International Harp Competition, which was just held here a week and a half ago. It showcases the talent at an unparalleled level, and we are fortunate that we are able to host that. My husband and I had the honor of hosting a board member for the competition, and several Rotarians, Peggy Frisbee, Steve, many Rotarians have hosted people in the past who have been competitors. So I share this as I think it's truly awe-inspiring and demonstrates the power of bringing the international community together to inspire us all to excel in our passions. And I encourage anyone who would like to know more information about that to ask, because it's a great opportunity to meet people from different cultures. On that, I'd like to invite Judy Schroeder up for the reflection.
Hi, everybody. In 1988, at the very same induction service, Bob Salzberg and I were inducted together. I guess they thought editors were a good idea. We've been on the newsletter committee, I think, just about ever since, and I've been chairing that group for more than 30 years. It's quite an amazing group. A reporter spends several hours after each of our weekly meetings summarizing this so that you can spend 5 minutes reading the newsletter. This has been the most devoted group that you can imagine. I found a list of reporters from 10 years ago, and 7 of them are currently reporting. Sarah Laughlin, Jim Bright, Bill Perkins. Where are you, Bill? I saw, there you are. Glenda Murray, Ellen Barker, and Bob Salzberg. We've also had we've had 5 wonderful people who have stepped forward in the last few years: Greer Carson, Amy Hull, Sam Ujdak, Andrea Murray, and this month's reporter, Bill Oates. And I want to mention those who've retired from honorable service: John Diltz, Steve Moberly, Connie Shikalis, Tim Thrasher, and Charlotte Zitlow. I remember typing, I mean typing on an 8.5 by 14-inch sheet, the newsletter, and taking it down to a copy machine on the square where they'd copy it and put it in the mail to Rotarians, hoping that it got there before the next meeting. Well, times have changed, and now that members who can't make a meeting are able to join us on Zoom or can look on Zoom afterwards, or on YouTube, sorry, more changes are probably overdue. I hope that the one reporter I haven't mentioned, Marilyn Wood, longtime reporter and the new committee chair, will shake things up a bit. If you have suggestions, I'm sure Marilyn, who's basking now in Florida, would love to hear them. I spent much of May, in Oregon and Northern California, visiting my family of origin. 23 family members, ranging in age from 3 weeks to 86 years. During that time, Marilyn ably edited the newsletter. She's less persnickety, more easygoing than I, which I'm sure reporters will appreciate. By the way, this is not a lectern. It's a podium. A podium I mean the other way around. The other way around. This is not a podium. This is a lectern. A podium is that little box on which the orchestra conductor stands on. I mean, on which the orchestra conductor stands. So you get the idea. So change is the only constant. The rotary wheel gathers no moss. And I look forward to the future. Thank you.
Judy, the only thing missing is the mic drop because you make it so easy. I don't even look at the notes because I know that you're going to, and persnickety is a good word, I'll just say. You have done a phenomenal job. And I say it every week that reporting is the hardest task of all of the volunteer efforts that we do in our weekly service. So appreciate you and appreciate everyone who volunteers to do that. And with that, Dave, if you would announce all of our guests, please, here and online.
Welcome, Rotarians and guests. I would like to introduce the guests first in the room, and if you would stand when we say your name so that we may recognize you. Scott Spence is a guest of Craig Spence. Jeffrey Berger is a guest of Joy Harder. Nicole Day is a guest of Heidi Schultz. And Maisie Cochran is a guest of her mom, wherever they are. There they are. Do we have any guests online?
We do. It's a banner day on Zoom. We have Sarah Greenwell and Megan Gerhardt, both Rotary Global Scholars.
Wonderful. So any of our guests, if you have any questions about Rotary, or you might be think you might be interested in membership or just knowing more, please look to your left or your right and ask anyone for more information. Thank you.
All right, and we only have one birthday because this person owns the week. Mr. Rotary himself, Jim Bright, on the 5th. But we make up for it in anniversaries. We have lots of anniversaries to celebrate. Fred Dunn, 52 years. Sally Gaskell, 26 years. Marshall Goss, 38 years. Mike Hoff, 32 years. Judy Schroeder, 37 years. Winston Schindel, 43 years. Tim Thrasher, 44 years. And Bob Salzberg, 37 years. Those are some serious numbers. And now for announcements. I'll start off with Charlotte. Our own Dame Charlotte has decided to move into Beltrace and will be joining that wonderful community in the next few months. I would ask, and I'd like to ask that all of us save any boxes or newspapers. We all remember what those were. So that she can begin packing with her family. So if you could break them down and just call her and drop them at her house, it would be greatly appreciated. That is going to be super awesome having you closer to us. We can have wine evenings. Secondly, okay, this announcement, I wanted to let you all know, if you hadn't figured it out already, Jim Bright is on the mend from his pneumonia. Not only is he on the mend, he's here. So I'm pretty sure the doctor said you were supposed to take a bit more time, but you're Jim Bright and that's what you do. Next, phenomenal results from Teachers Warehouse. Ann shared that they had 1,181 unique educators come to Teachers Warehouse over the past year. That averaged out to about $318 per educator that was shared. Most materials are gently used and donated by individuals and businesses and in our community. And then Teachers Warehouse raised over $45,000 to provide new materials that are in high demand. So look forward to a link coming soon for, I believe it's July 12th, when we'll be doing the Kroger supply drive, and we'll need lots of people to sign up for that. It's a lot of fun. And the great thing is the community is always very giving. And then lastly, and not on a not so bright note, apparently just was notified that our past Toast honoree, Bob Hamill, has actually taking hospice care at this point. So just FYI, keep him in your prayers. And we'll do a quick happy dollars. Michael?
Hi, this weekend was the 4th annual community picnic for refugees and their volunteers and friends. It was at Upper Cascades and it was a phenomenal success. Weather was great. We had over 120 people, kids everywhere, people from, I think, up to 10 different countries. And it was just, like I said, a great success. So I'm going to give $10 happy dollars for that.
Hello. I'll give $10 happy dollars for the lifelong impact of Rotary. I grew up in a small town in Oklahoma, and my dad was very involved in the local Rotary Club, and we hosted multiple exchange students, some of whom we've kept in more contact with than others. And in, I think it was 92, we had a guy from Australia. I was in the 5th grade. And his name is Andrew, and we've kept in a lot of contact with him. He was here at my sister's wedding last year. And he called us recently. I don't know, this makes me emotional. He called us recently to tell us that he's moving to the United States and he's going to be living. I messaged with him this week, and they just bought a house not far from Chicago. And I said, well, you're just up the road. So my Australian brother. So just to show you the lifelong impact of Rotary and the youth exchange program.
Well, I have a similar story. I spent a little time on the phone this morning with a guy named Rob Lucas, who's from Southern Illinois, Carbondale area. And he called to find out information about Teachers Warehouse because he's hoping to start one in his area. And I asked him if he was a Rotarian. He said, no, but actually I'm from Bloomington and my dad was a member of this club, Paul Lucas.
Oh, wow.
And he was a Rotary exchange student. So guess what? I'm going to email the president of that Carbondale Rotary Club. He's going to get an invitation pretty soon.
What's wrong? Get rid of your video if you're going
I'm giving $2 Rotary because
you there eating.
closet signed on mortgage on Thursday. We are so excited for our new location. And also, we are starting to put some serious wheels on this sculpture, which we're going to be unveiling June 24th. So $1 for each of those because I'm cheap.
We have time for one more.
I'm happy because we got to visit my son and his family in San Antonio last weekend, and it was just great seeing him and our lovely grandchildren. So it was a real treat.
All right. Thank you. And what great stories. That was it. That's all we had time for. Sorry. So a lot of happiness going around. I'm sorry we couldn't get to all of you. With that, Jeff McKim, because everybody's waiting to hear this fabulous program. Come on up.
Fellow Rotarians, it is my pleasure to introduce Suzanne Koessel, a community leader I've had the privilege of working with for several years through our shared commitment to mental health and community well-being. She's going to talk to us about some really exciting new developments in community behavioral health care. Suzanne is the Chief Executive Officer of Centerstone of Indiana, a role she's held for the past 16 years. Under her leadership, Centerstone has become a cornerstone of behavioral health services across eastern and south central Indiana, serving more than 35,000 individuals each year. Suzanne has been with Centerstone for 29 years and brings over 35 years of experience in the field of behavioral health. Her career has included roles as therapist, community planner, grant writer, director of business development, and chief operating officer. In addition to her work at Centerstone, Suzanne serves on the board of directors of Mental Health of America of Indiana, as well as Indiana Council Board of Directors and Public Policy Committee. Please join us in welcoming Suzanne Koessel.
Well, thank you, everybody. Let's see. Didn't share that he's the past chair and current board member for Centerstone. He represents Monroe County, and I'm just so grateful for his input, his engagement. He's just a wonderful human, as all of you know very well, having been here on Rotary with him. All right, so I'm here to talk to you a little bit about this new operating model that is coming about in community mental health. It's really, I think of it as the new system for the new structure for the public mental health across the country, and really this unique opportunity we have here in Indiana and Bloomington in particular to implement it. I thought I'd start by going back a little bit and kind of sharing our history as a community mental health center in Indiana and our own evolution, and then talk to you a little bit about this new model. So I think most of us know somebody that has struggled with mental health or substance use, maybe a family member, maybe a friend, maybe even ourselves at some point along the way. I know for myself and my family, my great-grandmother committed suicide, and then when I was a child, my grandfather committed suicide. And while fortunately nothing like that since in our family, we've had a number of our family members who have really benefited from mental health care. So maybe it was kind of my destiny to get into this work, but I really first became familiar with the organization that I now lead as a student intern. I was a student here at IU, and I got an internship at South Central Community Mental Health Center. You may remember that name if you've been around Bloomington a while. And I was just amazed. I fell in love almost immediately with the clients, with the staff working there, and the kind of holistic, whole person, compassionate care that was provided and the difference that people were making. Fast forward, as Jeff said, I got to come back to the organization after some work with the state and work as a therapist, and got to be part of this organization now for almost 29 years. So grateful for that. So I wanted to start out with just kind of underscoring and kind of bringing your attention to why this is such an important issue, if you're not already in touch with that personally. So in 2021, the Indiana Department of Health reported that 46% of all Indiana students felt sad or hopeless, 27% of them seriously contemplated suicide, and 11.8% of them actually made a suicide attempt. In Indiana, the Mental Health America report ranked Indiana's mental health system as 43rd in the country, not such a good standing. The CDC in 2023 reported that Indiana had a higher percentage of overdose rates above the national average, despite a lot of good work and that number coming down from the prior year by 18%. And then lastly, something we've known for a while, but it was really confirmed by the World Health Organization, is that people who suffer from chronic substance use or mental illness have a 17-year shorter life expectancy than the general population. And that's due to a variety of factors, but lots of comorbidity, right, with other health conditions. So kind of just starting out with who we are. We are here to deliver care that changes people's lives. That's our why. That's our mission statement. We've had many over the years that I've been here. We've kind of settled on into this one over the past 10 or so. And to me, it really is our true north and why we all are here to do at Centerstone to do what we do. We do that by providing mental health and substance use services. There's such a really wonderful continuum as part of what I love about Centerstone. But I kind of divide them up into these 5 buckets that kind of make sense to me. I think most of us, when we think about counseling or we think about therapy, is when we think about mental health care. The other a big piece of what we do is psychosocial rehabilitation, which is kind of a horrible mouthful of a name, but it's really critical, not just to help people deal with symptoms, but also develop the skills and supports they need to live a life in recovery and to kind of get on with healing. We provide psychiatric care, but also primary care. We have a primary care clinic in our clinic, as well as a full-service pharmacy. We do residential treatment and permanent supportive housing and therapeutic foster care. And then last but not least, we've really seen a big increase in our crisis response services in the past 5 years since the initiation of 988, that 3-digit number. We're able to partner with the county, the city, IU Health, Cook, the Bloomington Foundation, Monroe County Foundation, to really come together and build the Stride Center, which is located on Morton Street. It's a crisis diversion center. People can come drop in, no questions asked. We work with law enforcement and first responders also as really an alternative to hospital, ER, or transported to Stride Center or to the hospital if they need that, or to a friend or family members, or just to help resolve things until the next day. We do crisis debriefing in the community, so kind of in response to natural disasters or fires or critical events. We will go out and either one time or for a week or a month and just help people put the pieces back together, either process or get connected to practical resources. So all of those services, that continuum of care really came and started with the Community Mental Health Center Act in 1963. That was part of the Kennedy administration, and it was really the first time that this country established a way for people across the country to have access to care that wasn't in an institution. And it was with that enabling enacting legislation, we established South Central Community Mental Health Center, such a mouthful, in 1967, and built our clinic there on Rogers Street, which some of you may be familiar with. It's really like we got that beautiful park now in front of it. It's on University and Rogers now, because now that university runs through near the Beeline Trail. Centerstone, fast forward to 2007, became to be as a result of the bringing together of 3 community mental health centers in Indiana, a few small nonprofits, and we got together with a large community mental health center in Nashville, Tennessee, forming the first multi-state community mental health center. So it's a nonprofit organization that does all the work that I just described, but across a few states. We've since grown and added our services in Illinois and Florida, as well as a national provider network providing culturally competent care to military service members and their families, and a research institute that works with different organizations to do clinical training. We have a simulation training center, patient safety organization, a whole variety of activities that really help to, I think, elevate the quality of care, not just at our organization, but in the industry. So this is Centerstone today and where we are. We are across, this is in Indiana, we're across the state, as you can see, all of those shaded counties with some clients. Our primary service area would be the orange colored counties. That's where we are the designated community mental health center for that county, as well as since January, the certified community behavioral health clinic for the county.
We have over 1,300 employees here in Indiana, and as Jeff mentioned earlier, we served over 35,000 people last year. We have over 500 beds or apartments. That's a real mixture of residential treatment and also permanent supportive housing that we've developed over the years. So what next? All this growth and expansion, why are we here? I would say that 1 in 5 people this past year had a mental health condition. Out of 3 of those people did not get adequate treatment or care. And 1 out of 3 people who visit the ER for mental health or substance use treatment don't get follow-up care within 30 days. So just simply put, the need for care in our country is really outpacing the access and availability. So Certified Community Behavioral Health Clinics, CCBHC. We're really good at acronyms in our industry, unfortunately. I don't think we got a better one with this. We just got a longer one, quite frankly. But I really like to think of this as really the first major change in our public mental health system since that enacting legislation. We've certainly had growth, but we haven't had the kind of fundamental change in our operating model. And to me, it's the comparisons of DOS and Windows, for those of you who that rings true, or the rotary phone and the smartphone. They're both operating systems, right? But one clearly outpaces the other. So here are some of the key components for the new operating model that has been proposed, or that we are now beginning to implement. The first component that I'd like to call out is just the access to care standards. There are new standards as well as new resources to expand the availability of services, and set standards for how quickly people can get into treatment. The other area is the care coordination. We have long known that is critical as people make transitions from one level of care to the next, or need other additional resources in the course of their recovery process or their healing process, that making those connections to other services, with primary care providers, and other systems is really crucial in order for people to stay engaged and continue to move forward. There's a required set of 9 services that are part of the CCBHC model, and frankly, we were providing all of them. What is different, I think, is there's some enhancements in the design, in the evidence-based practices that are required in the course of those services, and just the kind of equitable distribution across all service areas and access. Organizational authority and governance is impacted, bringing consumer and community voice into the design and prioritization of how services are delivered. More funding for staffing and an expansion of staffing resources. On average, in CCBHC, staffing increases by 15%, and I can tell you that's already happening here in Indiana and here in Bloomington. And then quality and other reporting. So there's a lot greater emphasis on data and transparency, and having a demonstrable impact that can be described. I think that really the key point here is that comprehensive care and the resources to provide it are really what is critical. So how does this all come about changing? And I think in order to implement a best practices model, you have to have the resources to do it. And unfortunately, after decades of really stagnant funding and staffing challenges and diminishing resources, what this really brings is an opportunity for us to do all of the things, to have a reimbursement model that allows us to do all of the things that we know are high quality care. So rather in a sustainable way. I think that in the past, we've been able to stretch resources,
to be able to provide the components of care that maybe weren't funded, but we knew were important, maybe get a grant to make an investment for a period of time. But what CCBHC really offers is an expense-based reimbursement model for really an optimal design. So CCBHC is spreading across the country. You can see this from this very colorful picture that it really is popping up in almost every state across the country. The states in orange are where it has been fully adopted as the state public mental health delivery system. And the stars are the newly awarded sites by the federal government as of this past year. And you can see Indiana is one of them. And I actually love to say that Lindsay Potts, who is from this community, she really led the state's effort and application process. And Indiana received the highest score in the country. Not to brag at all, but yeah. She's pretty amazing if you know her. So anyway, we were one of 8 organizations, Centerstone in Indiana, that was selected to be part of the state's initial implementation of this model. And that started for us in January. Yeah, so we're really excited. We're 5 months in and have a lot to do, but already a lot of really positive things going on. The other thing that I will say is that CCBHC, despite these kind of challenging, let's say, political times, has continued to really have bipartisan support. And it is still there in the federal budget. It's in the president's budget. It's in the state legislature's budget. So it's one of the things that survived, thankfully. And I think it's a model that people can get behind and can see the demonstrated results. I think everybody across the aisles is really knows that we need to do something more and different in this regard. So grateful for that. So in those 12 states that have been doing CCBHC for a while now, they're having some really amazing results. People who received care at CCBHC saw a 72% reduction in the hospitalization rate. They saw a 41% reduction in the homelessness rate, and they saw spent 60% less time in jails. So those were some pretty dramatic results that came out of those original 12 states. We also saw workforce issues being positively addressed. And those blue bars on the right really show you the impact first on retention, improved by 44%, recruitment by 45%, and vacancy rate improved by 37%. So really attending to some of the core issues that we know are challenges for us in our system. So this is some of the early progress in Indiana. This slide was shared last week at a meeting I was at. There were 30,000 people that got CCBHC services in the first quarter in Indiana. And when you look down there at those blue bars, it's kind of hard to read the way the coloring is, but in CCBHCs, it took on average 4 days to get into care compared to the other community mental health centers in the state where the average was 11 days. So that's really, really positive news. The other thing I'll say is just that there's lots of work to do. We are just at the beginning of this journey. We have, like I said, been able to add staff. We've added services. We've expanded our crisis response. So all that with sustainable funding, which is remarkable. And I can honestly say in my 28 years of working for this organization that really nothing has excited me more. We did a lot of work lobbying for this and really promoting this, explaining this, talking about this. So excited to have it come to fruition. I think it really offers some hope for the way forward in terms of both the model of care, but also the resources to provide it. So I'm going to end there, so we have time for questions. But first, I wanted to share a video. Ryan was a client of ours, and he was one of a few that wanted to share his story. And it's short, but to me, it says it much better than I ever could. So I'll let that go.
I lost both my parents before the age of 8, and I stayed with the same foster home from 11 to 18. My addiction started after high school. When I got in the car accident, I was 21 years old. I was living in West Palm Beach, Florida. At the ER, they gave me a prescription of hydrocodone, and over time, from 11 to 18. My addiction started after high school. When I got in the car accident, I was 21 years old. I was living in West Palm Beach, Florida. At the ER, they gave me a prescription of hydrocodone. And over time, it took more medication to mask the pain. I moved over to drug seeking and found heroin and fentanyl. I lost everything, lost my apartment, lost my car, lost all my friends, and just started on that terrible road that so many people know about. Well, in my 8 years of addiction, I became homeless, I became a thief, a liar. Whatever money I came across, whatever job I worked, all the money went to drugs. Off and on, I would try to stop myself. I'd try to white knuckle it, and it would last for about 2 or 3 days. Then I was back out there. I was in a parking lot at a Walmart, and all I had left was my car. And I called my drug dealer, and I said, I'll give you my car for $300 worth of drugs. And he said, okay. And right after I made that call, my foster mom called, and I broke down. I told her everything that's happened. I needed help. It still hurts me to this day that I did that to them. They were the only people that stood by my side. I went to the Centerstone rehab facility, and it was the best decision I ever made in my life. I met some really good people. They helped me transition back into the community, helped me understand how to live a life free of addiction. I have my own car, I have a job, my family's back in my life. Just having people in your life that can rely on you and you can rely on them is just a wonderful feeling, you know? Like, that's what life's all about. When I was in active addiction, I never had any thought besides the next day or even the next high. There was no future to think about. But now that I'm in recovery, I think about having kids down the road and helping them grow, having a wife. There's nothing holding me back anymore.
I have a family member who is severely bipolar, and because of this organization, she has been able to live a normal life for over 40 years. So
Well,
they do a great job.
thank you. Thank you for sharing that.
Can you compare and contrast the challenges that you face in urban areas versus suburban areas versus rural areas? When I look at your map, I see that you're in all of them.
Yeah, we are. You know, we are in all of them. I would say most of the areas we serve are more rural, but Bloomington's kind of the big urban center is our headquarters. I think they're different. I think we see more complexity, more people who are maybe unhoused. Than in the more rural areas, although that's really changing. Quite honestly, affordable housing is a problem in almost every community I go to and staff I talk to. So that it's hard to do anything until people have a place to live and a roof over their head, right? So.
Suzanne, yesterday's front page of the Herald Times talked about an addiction that I hadn't really thought about, and that's gambling. And it talked about the number of young people who are gambling online and wrecking their present and their future. Is this something, A, that you recognize, and B, is it something that Centerstone is called upon to address?
Yeah, we do some work around gambling addiction. I would say we have a lot to do to kind of better reach that population. I don't think anybody's doing a real great job of it yet that I'm aware of, particularly in Indiana, in this community. But agree with you, that's a challenge. We do some of it, but it's limited.
Yes, excuse me. I moved here in 1964, and I came from a place where there was not such good mental health care. And I found a therapist, one therapist in Bloomington, and then in Indianapolis, somebody. But eventually they did speaking therapy, talking about, but and then one day I got on the board. I was on the board of this when it changed. And when Denny Morrison took over, it turned into behavioral health rather than mental health.
Yeah.
And the result was that the recommendations that were made was drugs, medication, not talk therapy at all. And I wonder if is that still the way it is?
That's a good question. I would say that most people that get services that does not include psychiatric services or medication services. But it is a part for maybe 20–30% of the folks that we serve. I think particularly in the space of substance use treatment, medication-assisted treatment is an important component. I don't think it works as a standalone component. I think you need the talk therapy as well, as you put it, and sometimes a lot of those other supports, the support with building recovery skills and recovery community. So housing, employment assistance. There's just a lot of factors, but yeah, so medications are part of what we do, but certainly not universal.
Sally, do we have any questions online?
Not at this time. Oh, wait, Raj has a question. Raj.
Well, lady, thank you so much for a very enlightening presentation for us. I have a few questions to you. And one of them is, have the medical community at large recognized any sort of addiction to be a disease? That is one. And what is the advancement in that particular diagnosis? The second question, what is your cooperation with the local health net in Bloomington and rendering care for the client of the health net? Thirdly, does the current treatment of addiction cover meditation, which is considered in a lot of time part of the therapy? And finally, what is the mental health cuts in the current budgets from the state, the county, and the national? Thank you.
Okay, let's see how good my memory is.
Oh, I always could come back.
Okay, I forget something. I think I'm going to go backwards let's see. So the cuts on funding, I would say the most important kind of core funding was left intact by the state legislature. We feel like that was a huge, huge win. Didn't look likely at some points during the session, to be quite honest, but and at the federal level, what we're seeing in terms of cuts so far has more to do with federal grants than it does our core funding. Although, make no mistake, many of the people we serve are have Medicaid as their primary funding source for care, and so as that program gets kind of hacked at, let's say, gets whittled away a bit, that will have impact on our organization and what, the resources we have to do our job. But so far, I feel, kind of count myself among the lucky. I think some of the other cuts are a little broader, more specific programs. There seems to be a move toward cutting some of the specific programs, kind of under the auspice of duplication or redundancy, but leaving some of the bigger core programs like CCBHC and 988 alone. But we'll see. There's a lot yet to happen and be uncovered. I think you were asking about addictions treatment. We do provide medication-assisted treatment as part of our substance use treatment programs. Our associate medical director is an addictionologist, and really most of our psychiatrists and nurse practitioners work in that space. And like I was saying earlier, I think it's an important component, but it should never be just the only component. I don't think that's usually as effective. And in terms of primary care and general health care and our collaboration, we do work with HealthNet and other federally qualified health centers and other health providers in general in this community and others. That's, as I mentioned earlier, folks tend to have, there's a lot of comorbidity between folks we see, and they tend to have other health conditions. And we know that the mind and body are not separate things, and you got to treat the whole person in order for improvements to happen. So we do a lot of, part of the CCBHC model that I didn't talk about is a lot of primary care screening. And I'll tell you already from doing that, we have had people that, may have had a stroke or a heart attack had we not kind of caught an escalating condition and got them connected with primary care. So that's definitely part of the model and part of best practice. So I'm going to stop. I think I got most of it, but if not, someone else let me know.
My first question was, has the medical community at large accepted any sort of addiction as a form of a disease? And if so, is there any advancement in such a diagnosis on principle beyond the theory of it?
Yeah. Yeah, I think so. That would be my answer. My short answer is yes. I think by and large, yes, not universally, but I see in general that there's just a much broader recognition of mental health conditions and substance addictions as a legitimate medical diagnosis that is assessed and screened for, and hopefully people are connected to services.
Thank you.
Yeah.
Thanks for all you do. Could you describe how your organization's services could impact extremist violence?
Gosh, so it's an interesting question. We have been recently, actually through our research institute, developing some more screening tools around violence and pathways. We call them clinical pathways. We have them for overdose prevention and suicide prevention, and now violence prevention. So we're trying to kind of identify those possibilities on the front end and just have a quicker and earlier response and intervention for people who are in services. But it's a real concern. It's a concern of our staff and our other clients. I think a lot of the drug use that we see these days is really exasperating that, and the population that we serve is more violent than they used to be in some parts anyway.
Hi. Um, for those of us who have loved ones who are struggling with addiction
Yeah.
and may not be ready to go to treatment, how do we go about striking a balance between not enabling them and also not abandoning them?
Yeah, there's a lot of work in that. The first thing that pops into my head is Al-Anon, which is something I attended for a long time. I think that it's tricky business, and I think each person's answer to that question is really unique and individual. I think personally, I just try to stay present and engaged, and also recognize just my own limitations with that, how much I can bear witness to for how long, and also, being humble and recognizing we all have our struggles. So just trying to be really honest and authentic about that. I don't know, but I'm happy to have a longer conversation.
Thanks for being here. I think we're running out of time, but you mentioned a lot of your clients are rural or come from rural areas. Can you just briefly talk about access to treatment issues? So are they able to access virtual
Yeah.
if they're going through talk therapy or something? Can
Yeah.
you do virtual, or is that a huge hurdle to get them access to
Get them
treatment?
access. So I would say that when I came to the organization, about 80% of the work we did was done in our clinics. And I would say today, only about 30% of the work we do is in our clinics. We go to people's houses, we go to other community settings. Gosh, in most of our schools across our service areas to see kids and families. So we're doing a lot of going to people, but we're also using telehealth. And I would say, I think when I looked at the numbers before the pandemic, about 2% of our services were delivered via telehealth. Since the pandemic, I'd say we've settled in right around 14 to 16% of our services are delivered through telehealth. And part of that is because it helps connect maybe a specific expertise with a person, or a better fit therapist-wise or clinician-wise. It sometimes, we've discovered during the pandemic, while it doesn't work for everything, particularly engagement with kids is hard through telehealth, but it does work in a lot of cases and helps eliminate those barriers, like transportation and childcare and other things. Yeah. Thank you.
What a program. Thank you, Suzanne, and thank you for all that you do in the community. As a CASA, I know that many, many of our families get reunited through the help from Centerstone. So thank you. In honor of your program, we'll be donating $100 to the Bloomington Symphony. So thank you for that. And in recognition of all those who helped bring this program to life, thank you. Natalie is our executive assistant. Diana Hoffman is our greeter. Very thorough, I might add, Diana. Dave Meyer on introductions. Joy Harder. Actually, you're here. It's Sally. That's right. Sally is our Zoom host. Bill Oates, thank you for doing the hardest job reporting. Michael Shermis, as always, quick on your feet with the mic and the video. And then Tyler, thank you for working the audio and video. And by the way, for those of you who didn't notice at the very beginning, the little room said Bloomington Rotary Sour. It should have said sound. And someone, I won't mention any names, Jim Harvey suggested that might be a good fundraiser. We could do Bloomington Rotary Sours next time. We'll sell those. So our next meeting will be on the 10th at the Upper Cascades picnic spot. It is our fun time. We'll have a social cantina that's going to be catering, and the program's really going to be about awards and recognition. And just a chance for us to all socialize and meet all the new members that we have here. So looking forward to seeing everyone there. And with that, if you could put up the test, and for those able, please stand. Of the things we think, say, or do, first, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? Fourth, will it be beneficial to all concerned? And fifth, is it fun?